So, I'm Cassandra again. You might have heard my opponents talking about euthanasia in some of their claims, but the thing is that we're not talking about euthanasia here, we're talking about physician-assisted suicide, and just to clear it up, euthanasia is sometimes confused with physician-assisted suicide because euthanasia is when doctors directly give terminally ill patients drugs that would directly kill them, instead of physician-assisted suicide where the doctor prescribes something and the patient takes it on their own. So this therefore makes that claim irrelevant. So technically a doctor is not violating any of their rights because in physician-assisted suicide, the patient does it on their own and the doctor just provides the medication. So according to an article named Physician-Assisted Suicide is a Murder or Compassion for a Doctor to Help Kill a Patient that was just published a couple of weeks ago, it's important to recognize that we're not talking about legalizing all assisted types of suicide, says Rita Marker, attorney and executive director of the Patient Rights Council. The laws in Oregon and Washington transformed the crime of assisted suicide into the legal medical treatment of doctor-prescribed suicide, says Marker. Second of all, my opponents also talked about how patients are living in a way that makes them helpless and they need a lot of assistance. So that leads us into what we're saying, that needing help to live causes suffering. And so while the people are helpless on their own, they aren't happy and they're not living the life that they would want to live. So it should be an option for them to end their own life in a peaceful way when they want to do it. According to an article that was produced by the Death with Dignity National Center, Death with Dignity laws allow a terminally ill patient to hasten an inevitable and unavoidable death, and it's not suicide, rather a possible option if the pain from underlying illness gets to be too much or the quality of life is too degraded. And finally, according to an article that was produced in the American Medical News, it has done more good than harm because it has forced the end-of-life discussion to come sooner and when people are more prepared. So it's not a harm because patients are very aware of what they are doing when they are given the option of physician-assisted suicide. According to an article that was from Boston University, 2 doctors have to confirm the terminal diagnosis and that patient was mentally competent to make medical decisions on their own. Doctors would also be required to present patients with alternatives, including pain control, and then the patient takes the drugs on their own. And also, another article that was from the U.S. National Library of Medicine, in all jurisdictions, the request for physician-assisted suicide has to be voluntary, well-considered, informed, and persistent over time. The requesting person must provide explicit written consent and must be competent at the time of the request made.